Good afternoon, and thank you for attending this meeting of the Adult Health and Social Care Policy Committee. The meeting today is open to the public, and there are no items that contain exempt information. Please note that there is an additional agenda item 12, the 2025-26 Quarter 1 Budget Monitoring Report. This report is provided in a supplementary pack. The meeting will be webcast and the recording will also be available for people to view later through the Council's website. It is also possible that Sheffield Live TV will record and rebroadcast the meeting. Please can I request that mobile telephones and other such equipment are switched to silent mode as to not to disturb the conduct of the meeting. There is no fire test planned for today and there is no emergency plans, but if there is an emergency evacuation, please take instruction from the town hall staff, and the assembly point for us is Tudor Square. I will now ask each committee members to introduce themselves, and I'll start on my left.
Good afternoon, I'm Councillor Laura McClean and I'm Group Spokesperson for this committee, and I'm a councillor in Walkley Ward.
Good afternoon, everyone. My name is Councillor Rooney and I represent Woodhouse Ward. Sorry.
Hello, Councillor Ruth Milsom. I represent Crooks and Crosspool Ward.
Councillor Jane Dunn.
Hello, I'm Christine Gilligan and I represent Hillsborough Ward.
Councillor Ruth Milsom, representing the good people of Standington.
Good afternoon, I'm Councillor Steve Harris and I represent Graves Park Ward.
Afternoon, Councillor Sophie Crossthorne for Beechcliff and Greenall Ward and Deputy Chair of the Policy Committee.
I think we are all here. We received no apologies and everybody is present, supposed to be here. So agenda item 2 is exclusion of press and public. As said before, there is nothing on the agenda today that is exempt, so we don't need to worry about that. And agenda item 3 is declaration of interests. Do any members have any declaration of any of the items on the agenda? That's a no, so we can go to item 4, which is the minutes from the previous meeting. These are on page 11 of the pack. So I will ask whether members agree that this is a true record of the meeting that we held on the 18th of June. People happy with that? And I will just go over page by page to see if there are any matters arising. Page 11, 12, 13, 14, 15, and 16. Are members happy for me to sign the minutes as a true record? Thank you. Thank you. Agenda item 6. Agenda item 5, membership of the Health Scrutiny Committee. These are 2 items to note for us. A, to note the resignation of Councillor John Wright as a member of the Health Scrutiny Sub-Committee with effect from the 10th of August 2025, and the appointment by the monitoring officer in consultation with the relevant political group whips of Councillor Laura McClean as a member to fill the vacancy with effect from the 26th of August 2025. And B, to note the resignation of Councillor Ruth Milsom as Chair of the Health and Scrutiny Sub-Committee with effect from the 21st of July 2025, and agree the appointment of Councillor Laura McClean as Chair of the Subcommittee for the remainder of the municipal year. Are members happy to agree on those, to note those 2? Great. So item 6, public questions, petitions and statements. We didn't receive any.
I think we need to vote for the Chair of Health Scrutiny rather than note it.
Okay, sorry. and agreed the appointment. Yes. So can we please vote on the chair of the Health Sub-Scrutiny? Are people happy to accept that? Thank you. Thanks. Public questions, petitions and statements, we received none within the timeline. Item 7, members' questions. Again, no members' questions were submitted on this occasion. So we go on to item 8, which is the work programme that is on page 19 of the pack. This is our work programme. As you well know, the work programme is a working work programme, as in it changes over the year. So if you look on page 22, so Fiona, are you going to go through it for us?
I can give an overview, yes. Obviously this is our standing item to update members on the current work programme for the Adult Health and Social Care Policy Committee. On page 22 we've got a few new items and one removed item since our last meeting in June, and the full work programme can be found on pages 25 to 28. I would like to make members aware that since this was published, standard budget monitoring items have been added to both December and March's policy committee meetings for Q2 and Q3 respectively. And then I remind members that the work programme is a live document, so feedback and comments are always welcome. Thank you.
Thank you. Yes, I had like an additional thing about the finance and performance, the financial reporting. So you've already mentioned that, which is great. So they are not in the published one, but they are already on the online one. Are there any question issues with the work programme? Yeah. Councillor Cross.
Chair, I think with the risks that are being highlighted within the Adult Health and Social Care budget, it would be, I think, prudent to add to our work programme an issue around the governance and the budget administration planning ahead of the budget for this year. I don't know whether you want to take a pause to discuss on this, just to discuss a form of words for the addition, but...
Shall we take it when we take the budget item at the end and just preempt that we may be adding to the work programme? Because we can do at any point, we can do it, you know, in a briefing. So the work programme, any members can ask for things to be added, and if appropriate, we can approve. Brilliant.
Shall I raise that at that report?
Thank you. So, in the meantime, are members happy to approve the work programme with the additions of the quarterly financial monitoring, which are going into which months?
December and March.
December and March, which is the one that was also missed on today. That is the normal quarterly report that comes after the Finance and Performance Committee approves it. We just note it, the report just as today's item 12. Are members happy with that? Brilliant, thank you. So we are going on to item 9, which is the gas report, and I will pass on to Matt for that. And whilst the microphone gets sorted, I apologise, I didn't ask officers to introduce themselves. So can officers introduce themselves when they start presenting? Thanks. Apologies, Matt.
Thank you, Chair. I am Matt Bowsher, the Interim Strategic Director of Adult Social Care and Wellbeing, and the item today is the quarterly DAS update. Before I start the update, I'd just like to give a formal vote of thanks to the people who use care and support, carers, our statutory partners, the voluntary sector, especially Health Watch, elected members and staff, all of whom came together to provide an account of the work and the impact of adult social care when the CQC inspected us last week. We won't know the outcome of that inspection until probably December, but I will be attending a headline feedback session next week on Thursday, and I will share the outcome of those headlines with committee. We have shared links to the presentation that was delivered to the CQC with committee. If you haven't yet had the opportunity to view that content, it provides a really clear and comprehensive overview of the service provided, the pathways, performance, strengths, as well as the improvement priorities that has been debated at this committee before, and I would recommend that all members of the committee familiarise themselves with the content. I think the inspection overall was a reminder that when we work collectively and demonstrate the passion for adult social care in this city, that we can be a really powerful and positive force. And I won't lose sight of that, irrespective of the outcome of the process. And I'm extremely proud of everybody who contributed to the process. So thank you on behalf of the Directorate. In terms of the report itself, I'm going to assume that it's been read and pick out highlights. So the annual I statement return is now live. That's the means by which we monitor the impact of adult social care through the experience of people who use those services and carers, and that feedback's important in terms of sharpening and influencing our improvement priorities moving forwards. Our work on optimised care progresses. There's a series of sessions taking place this month with practitioners to look at the benefit of equipment, assistive technology and new care techniques. And the virtual equipment house is now live on the Sheffield directory. We'll share the link with members of the committee. The purpose of that tool is to let people know what can be brought into the home to support people to live independently. It's been designed in a way that's accessible and interactive, and it explains the art of the technically possible. So those of you who've got any doubts about what is technically possible, go and have a look at that virtual house and familiarise yourselves. Feedback welcomed. The Equality, Diversity and Inclusion Toolkit for Managers is now live. Having spoken to staff in our Equality and Diversity network, I acknowledge there's more that we've got to do to translate our strategy and our toolkits into the lived experience of people who are using care and support, and also our staff. And I've asked the Equality and Diversity network to actively challenge the Directorate leadership team to set out a series of asks in terms of further progress, and we will feed that back through here when Equality and Diversity comes to future committees. In terms of performance data, as the committee will be aware, I summarise exceptional performance. Exceptional in the sense of both positive and negative, where there's been a significant movement in the data. And that report comes from the detailed monthly data sets that the Directorate Leadership Team reviews. Moving forwards, and with the agreement of committee, I'll append the entire data set so that members can both interrogate and challenge all performance as required. So of particular note for the last quarter, our care home admissions continue to decrease for older adults and are now standing at 665 per 100,000 population. Our occupational therapy assessment waiting times increased from 563 to 563 days, but our median assessment time has improved from 43 days to 24 days, so we are exceeding the target set of 28 days. At the time of reporting the data for percentage of acute hospital beds by people who are discharge ready was 14.9%, compared to the like-for-like period in June 23, that's down from 18.8%. We continue to see strong performance in the availability of home care. There is currently only 10 people on the waiting list waiting for a care package to commence. That set against a performance baseline of 71 people. The median time for putting that support in place has been consistent at 4 days, and that is very fast and efficient performance. On annual reviews, we've continued a trajectory of incremental improvement to 55% within 12 months. However, we are some way away from the 80% target that was set at the start of the year. Our performance on safeguarding remains consistent, with 82% of all contacts screened in 1 working day. Our deprivation of liberty safeguard wait lists continue to rise up from 1,301 to 1,335 people. However, circa 50% of that wait list is for people who are waiting for their deprivation of liberty safeguard to be renewed. So they already have the control in place, but they have exceeded the 12-month period that the award was made for. We've seen a slight increase in the median number of days to complete an assessment, but we remain well under the target of 35 days at 32 days, so that is positive performance. In order to tackle the key areas of risk in all of the data I've just reeled off, we've now launched a DOLS improvement plan, DOLS deprivation of liberty safeguard, and we're implementing a new review strategy. What we're looking for is sustainable improvement in performance. We will not go from 55% to 80% overnight, nor will we see 1,335 people waiting for a DOL disappear immediately, but I expect to be able to demonstrate steady and sustained progress through the performance data here. All of that performance will be subject to oversight in this committee, as I said earlier, and also through the Continuous Improvement Board chaired by the Chief Executive. I do not intend to read the remainder of the report verbatim, and I'm happy to take any questions before we move to the recommendations. Thank you, Chair.
I have Councillor Gilligan and Councillor Milsom and Councillor McClean.
Thank you. Thank you, Chair. Yeah, I welcome the report. And really, this might not be a question, it might be just something I need to understand better, and it's about care home admissions. And we have a baseline of 659, it's page 34 if you're interested, and a target of 644. I'm just curious, how do we set the target and the baseline? I mean, I know that we are in an era of increasing people over 65, so why are we reducing the target when we know that the population as a whole is ageing? But I'm also very keen to recognise that the things that we're doing as a council might be why we're trying to reduce it. I've read the older people's housing strategy, which I think will make a big contribution, and we've just talked about the equipment, which will also help people stay in their homes. But I'm just curious about how we set this target and where it comes from.
Thank you, Councillor Cuba. So the target is set as one of our performance measures for the Better Care Fund. In terms of the expectations of NHS England, lower is better, and the reason for that is because it means that all those services that sit before somebody would be admitted to residential or nursing care are working more effectively and therefore decreasing the total number of people in care. I would say the primary reason for that in recent history in Sheffield is linked to domiciliary care capacity. So we have higher numbers of people receiving care in their own homes that are supporting them effectively. We have seen quite a different range of the level of intensity of support that goes in to meet individual need. But generally speaking, it is the policy of the council and it is an explicit aim of the Better Care Fund that we seek to continually try to drive that number down. The target itself is based on the demographics of the city, it's based on our previous performance, and it's based on benchmarking against other local authorities to look at per 100,000 population, which is why it's expressed that way, what successful performance would be. So it's a target we inherit rather than prescribe locally.
Councillor Mills.
Thank you, Chair. I wanted to ask about equipment, digital equipment in particular, and it's just thinking about this equipment house, which sounds very useful, and I will have a look at it, but wondering about the governance and performance monitoring around tech in care homes, and whether that sits under the responsibility, your responsibility or this committee's responsibility. And the reason I bring that up is because we've asked a lot of questions along the way about tech-enabled care in people's homes, but not particularly about residential. And I've recently heard a worrying incident of a person living with dementia who's in a home that is not a nursing home, which sounds inappropriate anyway, but they have a pad which is supposed to go like a mat next to their bed that alerts the staff when their feet touch the floor, and the staff in that home have moved. This is not in Sheffield, I hasten to add. The staff have moved the pad under the bed so that the resident does not step on it and disturb them in the night. It's just alerted me to think, how do we know how tech is being implemented in care homes, and how do we know how well that is being done, and if there are any issues? Thank you.
Thank you, Councillor Milsom. So, from a regulatory perspective, all external residential nursing homes are subject to oversight from the Care Quality Commission. So, the regulator would have the responsibility there, not the council per se. However, as part of the work we're doing on optimised care, we are working actively in partnership with a range of different providers, both residential nursing, dementia care and home care organisations. Rather than go through the detail here, what I'll do is arrange a written summary for you to showcase where that's happening. I'm pleased to hear that the home you referred to is not in Sheffield. What I would say is, if any member of the committee does hear concerns about technology being misused in the way described, that's in the train of safeguarding. So please raise in the ordinary way that you would do, but I'll arrange for a written summary of the work we're doing with residential nursing home providers in relation to technology. We encourage it. If technology is used proportionately, appropriately, staff are properly trained, and it doesn't diminish from an individual's experience, it can be a really powerful way of enabling risk. So, for instance, there's quite often instances with people with dementia wandering. Actually, if you restrict somebody's liberty and prevent them from moving when they want to, that is not a humane or a compassionate way to care for somebody. With a little GPS pin, as long as the person's safe within the home, it's absolutely fine. So that's one example, but I'll get you a fuller response as requested.
Councillor McClean.
Thank you for the report. The first thing I just wanted to say was just to thank you and the officer team for the work on the CQC inspection. I know it's been a really busy period, and just to extend our thanks as members for all the effort that's gone into that. And then I've just gone off my notes. Hang on, bear with me. I just wanted to ask about, you mentioned in your report about the inquiry by Cathy Williams, a former ADAS, about the social care voice and the COVID-19 public inquiry, and some of the highlights that she'd focused on. But I just wondered if you'd got any specific reflections on Sheffield after hearing what she had to say in the report. I'd just be interested. And then I also briefly wanted to ask about the dolls. I'm aware that we're all aware that it's a national concern at the moment, sort of dealing with dolls in a timely manner. And I just wondered, how soon do you think we'll start to see some change, even a small change in a positive direction in the data? Thank you.
Thank you for your kind words, Councillor McClean. So if I take the question about the COVID inquiry first, my major reflection, it's a national observation, not a Sheffield specific one, is that the policy, particularly in relation to quote-unquote red beds of discharging COVID-positive people into care homes, is one that should not be repeated. It clearly posed huge risks for existing residents. I don't think the performance benefit in terms of the NHS was demonstrated either. And I think there are now numerous conclusions that suggest the resilience that we needed to cater for a pandemic was not where it should have been. In times of emergency, we need to remember that social care has equal parity to the NHS, and vulnerability is vulnerability in both settings. And whilst I have nothing but respect and admiration from every member of the NHS who worked through that pandemic, moving somebody who is frail and vulnerable and COVID positive into an environment that surrounds themselves with countless other people in the same position was, I think, the wrong move. With some exceptions, I know that there were dedicated facilities that were used exclusively for that purpose, and some new care homes that were repurposed, in which case it made eminent sense. But that's my major reflection. And I know that there's a lot of local learning that's already been taken through the Health and Wellbeing Board here that we would do well not to lose sight of in terms of preparedness in the future. In relation to doles, it's very difficult to prescribe a precise time when we'll see sustained performance. I think there are two key things short term that will help accelerate positive improvement. The first is the availability of Section 12 medics. That's a huge part of the authorisation process. The way that we currently procure that could be improved. If we get better capacity that's available more frequently, we'll be able to accelerate through that waiting list faster. The second thing we need to look at is logistics, to see that where we have people in the same care setting, remembering that a lot of doles are in a residential and nursing setting, whether administratively we could seek to do multiple assessments when we're on site. A doles assessment is a complex, technical, time-consuming process that does need a lot of expertise to do accurately, but I think there are some process efficiencies that can be made to speed things up. I would say, in conclusion, however, that I don't think there is any authority in the country that doesn't have a wait list for doles, but I do think our trajectory is heading the wrong way and we need to do something to improve that position.
Before I bring Councillor Sapwell in, I just wanted to say about the COVID and the discharge into homes. I think it might be interesting to ask that question to the Director of Public Health, because I think in Sheffield we did it slightly differently. So our statistics are slightly more positive than other parts of the country, because we didn't blanket it, discharge people into care homes in the city. So I think, if I remember this rightly, we had about 500 less deaths in care homes compared to the average nationally. So it might be interesting to have that information from Greg. Councillor Sapwell.
Hi, Councillor Sapwell. Kind of councillor today, but a doctor otherwise. So one, just to completely echo your comments on discharging COVID-positive patients into care homes. As a medical registrar during the height of COVID, that was something that shocked me. And again, from my experience, there was no need to do it. And it undoubtedly caused excess deaths. So thank you for acknowledging that. Second, really pleased to see that home care waits are down to such small numbers, and that is no doubt helping us meet our targets for the percentage of beds taken up by patients who've got no medical reason to reside. This data covers summer. What are our predictions and estimations going into, as we are now in September? Are we on track? Do the targets change and allow a bit more slack in winter? And how are we going to perform against those targets, in your opinion? And then the second question is on doles. Do you have any idea of how many of those doles are community-based doles, and how many of those are acute requests from the acute hospital trusts? Because again, from my end, the delays in those can be problematic. Thank you.
Thank you, Councillor. Would that the targets did change during winter from a social care perspective, but they absolutely don't. So we've got a target expectation that is standard across the year. We all know what happens in the winter months in terms of demand on the system. There is a detailed briefing in relation to the winter plan that's coming through both the Health and Wellbeing Board and Health Scrutiny. So I'll make sure you're cited on that. I think we are in a strong position in terms of our domiciliary care capacity, and I don't see any reason why that will become more problematic. However, we do expect baseline demand to increase. We expect the rate of expected discharges to increase, and with it comes the assessment capacity that is necessary to keep flow going in the system. One of the pieces of work that we're actively beavering away on is in relation to brokerage. So one of the parts of our process that can be clunky and time-consuming for social workers is getting the right quality of care at the best price for the individual. My colleague Catherine Bunton over there is working on getting that operational. What that will do is take that responsibility out of the hands of social workers, so they'll identify the needs, hand over the request, the brokers go and resource the care. Crudely speaking, in the same way you might use Trivago or any other comparison website to source a hotel package. So that's one of our plans. We will monitor that with a very keen eye. We're already, it feels very early, but we're already getting into the rhythm of weekly calls. There's a formal escalation process in place. I meet with my counterpart in both the acutes and the AO for the ICB on a regular basis to go through all of that, and obviously given the current position with some of the recruitment pauses, we need to make sure that we've got the right capacity in the right place for the system to flow as it should do. So that's a very wordy response to your question, forgive me. The targets do not change, the demand will go up. At this point in time, we are putting our energies into looking at what additional capacity we need to put into place to try and mitigate that surge in demand.
Can I come back on a point there? Thank you very much for mentioning recruitment pauses, just for the public's attention. Could you explain what those recruitment pauses are within the NHS at the moment and how they're affecting our ability to look after patients and get them out of hospital?
Sorry, could you repeat the last part of that question?
You mentioned recruitment pauses, which is something that I'm aware of in my professional life, but just for the public's benefit, could you explain what these recruitment pauses are and how they might be affecting our ability to discharge patients from hospital over the winter?
Okay, so just to be clear, at this point in time, it's not affecting our ability to discharge, nor do I believe that is necessarily going to be the case. The process that's been put in place from the 1st of September, there is now a formal process for any vacancy that arises where really robust scrutiny will be given and the council will only recruit posts that are essential. The reason for that is the financial position, which we're going to come on to discuss more of later. There are formal exemptions in that process for roles that pertain to statutory work, and included within that are both approved mental health practitioners, mental health social workers and social workers. That doesn't necessarily mean that every single one of those posts will be authorised, but where we're talking about life and limb services, where we're talking about critical and acute care, there are exemptions built into that approach for us to work through. So I'm highlighting it as a background risk rather than something that I know to be a problem at this juncture, and will keep the committee posted with our workforce position as we work through in the coming months. I'll make sure that's reflected in the DAS report. On to the second part of your question about the doles. We had an item about doles here, I think in June. I believe that report contained within it the referral sources, a breakdown of where they come from. If you have a look back at that report and see if it answers your question, if it doesn't, I'll get you an update in terms of where the referral sources come from. From memory, residential and nursing homes are far and away the greatest category in terms of where we get the requests from. And there's a direct correlation between the Care Quality Commission going and doing an inspection and a clutch of doles requests coming through to the council. And I'll leave you to draw the inferences from those comments.
Thank you. Councillor Rooney, and then we'll bring it to a close.
Thank you very much, Chair. Apologies if I start going off on a tangent, but it was the mention of the Better Care Fund that sparked a couple of thoughts. My last memory of it is that proportionately the council put a significant amount more cash into that fund than the health service did. Is that still the case? And I was just wondering if we are getting out of this fund what we expected from it. So that's one question. And I have another one which is about this transformational programme that we're embarking on as a council. I fear that there's a danger we're putting all our eggs in the one basket, as we did with the Better Care Fund on 2 or 3 occasions in the past. So if you'd like to answer that, as I say, I may have gone off on a tangent. Apologies if I have.
Thanks, Councillor Rooney. So, in terms of the Better Care Fund, it's fair to say it's an extremely complicated pool, especially in Sheffield, And what you have into that pool are a range of different contributions, some of which are directly from government, some of which are services that pre-existed the creation of the Better Care Fund, but the council has decided to pool those resources in the governance to discuss with colleagues in the ICB. What I'll do is break it down and give you a headline position in terms of where the large blocks of the cash go and which parts of it are social care and which parts of it are health contributions. I think the overall size of the Better Care Fund in Sheffield is one of the biggest in the country. It's a huge pooled budget. There's a lot of activity that sits beneath it. That activity is routinely reported through the Health and Wellbeing Board, so I'll pull one of the reports there and summarise it to answer your question in more detail. And in terms of the transformation programme itself, that will be coming to committee in October, so we'll set out the detailed proposals there for debate.
Thank you. I had a question about the dole, but it's already been asked and answered. So before I go to recommendations that are on page 30, I just wanted to add my thanks for how the CQC leading up to the CQC inspection was organised, and all the staff that were involved, and the whole process. I know it was a lot of hard work, but on the in the week of the inspection it felt very well managed and organised, and yeah, so thank you officially from me. The recommendations for this item are on page 30. I just wanted to alert you to the fact that we are adding a recommendation number 4. We agreed this in pre-meeting on the back of what Matt said earlier about the performance report comment pack being added as an appendix to each DAS report. So I will read the 3 recommendations, and then the 4th one that was put together by legal, so that it fits in with our normal recommendations. So our first recommendation is to note the progress in delivering upon the adult care strategy, Living the Life You Want to Live. Number 2, note the performance update and areas for prioritisation and focus. Notes the preparation for CQC assessment, which will conclude before the end of 2025, which has already happened. And number 4, and this is the new one, requested that the most recent adult social care performance pack is appended to the DAS report for each committee meetings going forward. Are members happy to approve those recommendations? Brilliant, thank you. And we're moving on to item 10, which is the Older People's Housing Strategy 2025-2030. Please, could officers introduce themselves? Fiona is going to get your name tag and bring it to you.
Hello, my name's Dan Green. I'm a Strategic Housing Officer at the Council.
Thank you, Chair. My name's Georgina Parkin. I'm the Service Manager for Strategic Housing.
Thank you. So I'll just introduce the strategy, give a quick overview before we give you an opportunity to ask questions. So the Older People's Housing Strategy was approved by the Housing Policy Committee in June. Its vision is for Sheffield to be an age-friendly city that supports people to thrive in their own home, celebrates inclusivity and independence, and provides safe, affordable, well-designed homes with good connectivity to local services and communities. The strategy will support people living in all housing tenures, so it's not just a council housing or social housing strategy, and it will help us to deliver the city's overarching housing strategy and ensure its priorities are delivered for older adults. To help ensure this, the Older People's Housing Strategy is structured around the same 5 themes or ambitions of the parent strategy, and these are more homes and housing choice, housing carbon emissions will have been reduced to net zero by 2030, safe, good quality and comfortable homes, great safe neighbourhoods that people are happy to call home, and homes and housing services that end homelessness and support healthy, independent lives. So the strategy is focused on housing neighbourhoods and support that facilitates independent living in later life. And this includes mainstream age-friendly housing, specialist older people's housing for independent living, such as sheltered and extra care housing, housing support and guidance, and facilitating neighbourhoods that enable older adults to live safe, well and independently. So the strategy has a high-level action plan, and we are using this to focus the delivery of the council partners in the private sector, including homeowners. The action plan will be delivered through partnership working across the housing, health, care, energy and voluntary sectors. Its development has been informed by 2 phases of resident and partner consultation with significant levels of engagement at both stages, and this showed a high level of support for the strategy and its vision and priorities. The strategy was developed in collaboration with colleagues across housing, health and care, and under the guidance of a cross-sector steering group, including people with lived experience. And the strategy is aligned with outcomes in the adult social care strategy, including the safe and well, active and independent and connected and engaged outcomes. It will help to support early prevention and support ageing well, for example, through the delivery of more age-friendly homes, better and more accessible housing support, and making more use of technology. The strategy will also contribute to meeting the duty placed on local authorities by the Care Act 2014 to ensure people can get the information and advice they need to make good decisions about care and support and prevent or delay the development of the need for care. So the strategy sets out approaches for helping different tenures. It will help to improve housing options and support for the most vulnerable, but it also is focused on helping people to help themselves. For example, recognising that for homeowners, there's a clear preference for continuing to invest in their homes in later life. And sometimes additional information, guidance and support is required to do this, sometimes from the council. And it supports intergenerational living and the creation of mixed communities, including new neighbourhoods that are being planned and in the city centre. So the strategy is needed for a variety of reasons. Sheffield has a growing and increasingly diverse older population who contribute massively to the social and economic life of the city, but we also need to make sure that we meet their varied housing needs and address some of the key challenges, including having approximately 20,000 more people aged over 65 by 2040. This population will include 6,400 more older adults living with long-term limiting illness. We know we've got an uneven distribution of specialist older people's housing throughout the city, which may be contributing to health inequalities in the city. And we have an estimated shortfall of 6,450 properties, which provide varying levels of support and or care in schemes such as sheltered and extra care housing. So we're seeking formal endorsement for this strategy today because it will help to give further confidence to funders and service providers by demonstrating that Council has a joined up and credible approach to supporting independence and wellbeing in later life. We think it will demonstrate to partners that it's a joint piece of work and housing and adult social care are aligned on its content and delivery. And it will help to ensure ongoing collaboration and commitment between the housing and adult social care services to deliver the strategy's priorities. So before we go to the recommendations, I'm happy to take any questions that the committee might have.
Okay, before I go to Councillor Gilligan, I just wanted to say thank you for all the work that you've done on this, and you've briefed us as a committee in our Wednesday meetings at least twice that I can remember, probably more than that, and I certainly gave quite a lot of feedback on some of the areas. So I really feel like we can say that this is a joint kind of report, although it went to housing because it comes under housing, and it fits in really well with that. The ambitions that we have as a city to look at things in the whole rather than just look at the one particular perspective. So thank you for all the work that you've done on this, and I'm going to go to Councillor Gilligan.
Thank you, Chair. Thank you. I think it's an excellent report, and I fully support everything in there, and I like the 5 principles, and I hope it will happen. And it does talk about working together, which I think is absolutely essential, and I think that's the way forward for everything we do. And one of the questions I have to ask, and it might not be that you can answer this, is how closely can we work with the healthcare services? I'm just giving an example because I know some people who live in sheltered accommodation, private, not council run. So you have these blocks of housing, 60, 70 people in them, and they're all over 65. A lot of them are much more elderly. But they don't seem to work with the GP services, you know, and so they each have to find a GP and they each have to phone. And I just think, can we, when we're developing this strategy, can we work with the health services? Maybe we can have a GP that visits to give them their flu jabs in one go instead of every single elderly person struggling to. So it's really just saying, can we have more joined up working with other services to improve the lives of elderly people?
Yes, I mean, there's actually an action in the action plan that alludes to that, and it's something I think we found when we developed the Buchanan Green scheme. There was challenges in working with local GPs, for example. So we also have a housing, health and wellbeing group that will help us to work more closely, and I think that's perhaps one of the actions we'll be looking at through that group as well. But I think it is recognised that there is scope to do better on that, and we need to look at how we can manage to do that.
Sorry, Councillor Rooney.
Very much. Do we have any idea how many older people live in private rented sector? So a landlord that might have half a dozen properties or something of that nature. And what would be the expectation? What does this plan offer those people?
We know at the moment it's 5% or slightly less that of the older population live in private rented sector, but we know that's growing and it's likely to grow in the years to come. So the action plan does include working with private sector. We have the private renters bill coming through Parliament, and so that will give us more sort of leeway to tackle sort of poorer quality conditions in the private rented sector. But we do recognise that in the future there's going to be more older people living in that sector, so we'll be looking at ways to support older people to make sure that their homes are being maintained and adapted as necessary, and that we're also aware of their rights as well as the responsibilities.
So could I ask as a supplementary to that, what assistance is there for the landlord? Sorry about the voice, it's one of those things. What assistance is there to the landlord, or might there be in the future, to comply with the expectation of the tenant?
Thank you. It's a good question. So, as Dan's just mentioned, the Renters' Rights Bill is soon due to receive royal assent. So, as a local authority, we are working to understand what the implications of that bill might be for the authority, as well as understanding what benefits that's going to bring for the tenants that live in the private sector. We do expect that bill will bring considerable additional burdens to the authority in terms of inspection and regulation, and we will have to understand how we are going to meet those additional requirements. So that work will be ongoing, and we'll be taking forward reports via the Housing Policy Committee in terms of how we're going to respond to that. There's been additional government consultation recently about the Decent Home Standard. The consultation about that has talked about broadening that standard, introducing measures such as flooring as standard as part of that standard, and bringing in measures in relation to energy efficiency and standards for damp and mould. That consultation is also proposing to introduce those decent home standards for the private sector, and that can only be a positive thing, have that clarity about those standards, and that is across 10 years, potentially in supported housing as well going forward, so that means that anybody that's living in rented accommodation can expect the same standards in terms of their home. Again, we need to understand what that additional changes in standards will mean for us in terms of our regulatory role as a local authority. It should improve standards. It's going to be a positive thing for older people. As Dan said, we know that the numbers living in private rented is going to be increasing going forward. I think it's going to be important for us to make sure that we understand those and get good information and advice out to tenants, so that they can so they understand the steps that they need to take if those standards aren't what they should be.
Thank you. Councillor Milsom.
Thank you. In 1.12 on page 57, there's some numbers about estimated housing need and a shortfall of quite a big number. Well, it looks like a big number to me. I don't know whether that's a big number in the grand scheme of things, but it looks big. 6,450 properties that support older adults to live with independence. And comparing that with what's said in 1.14.6, closer working with housing, health and care to support independence, health and wellbeing, including improvements to prioritise an allocation of council properties to reduce risk of homelessness, unnecessary delays in leaving hospital, and better match people to adapted and age-friendly homes. I hope I'm reading it the right way, that these two things directly correlate. And I'm just thinking, like, is that a big number for a start? Is that like quite, a scary number and will take a long time to tackle? Are there things that have already been discussed in terms of capital strategy to address that sooner rather than later? And presumably when we're talking about delays in leaving hospital, this is some people who have been in a hospital and cannot go home to their previous environment and need housing in something suitable. And so they're stuck in hospital whilst waiting for housing to find something. Is that, have I understood that right? And roughly how, what percentage of discharges are we talking about that fit into that category?
It is a very large number, the shortfall. I think we have something like 3,000 properties at the moment, specialist accommodation, so it's almost a doubling. So it is a huge number. In terms of how we plan to deliver that, I mean, we know the majority of older people are homeowners, live in the private sector, so it's not, and currently the majority, over 80% of specialist housing is provided by social landlords. So one of the big asks is to try and encourage more private sector delivery of specialist older people's housing. But we're also working with our partners, registered provider partners, through the South Yorkshire Housing Partnership, for example, to look at opportunities for delivering more specialist older people's housing at the moment. In terms of capital budget, we don't have a budget set aside for specifically delivering older people's housing. In terms of the stock increase programme of the council, we do have some older people's housing in that, but it will be sort of a drop in the ocean of that overall shortfall figure. So we do need to work with, for example, the South Yorkshire Mayoral Combined Authority and Homes England to try and obtain as much funding as possible for older people's housing. And in terms of that last question about what percent of people. Sorry, could you repeat that about the discharge?
It was what percentage roughly of discharges are represented by this unnecessary delays in leaving hospital to go to suitable housing? Is that a big problem, or is this one or two people sort of thing?
I don't know that. I don't know the answer to that. I'd have to get back to you. Oh, I think Matt has it looks like he may be able to answer that better.
Yeah, I can't quote you the specific figure right now, and I'm sure you wouldn't expect me to be able to, but we'll have a look at the discharge data and see what we can drill down. What we do have is a whole raft of different interventions available for people who don't have appropriate accommodation to go to, so it might be that the data is a little cloudy, but we'll have a look for you.
Gina.
Thank you. I believe as well you asked about allocation. Did you ask about how we use our social stock?
Well, yeah, I'm interested in how. I mean, this just says there will be improvements to the prioritisation and allocation of council properties to reduce risk and house people more appropriately. Obviously, there's not any detail there about how that happens, and we haven't got time to go into it now, obviously. But I'm interested to see how what the short-term, medium-term, and long-term steps in that ambition are, and how quickly we feel we can address the issue.
We are currently reviewing the allocation policy for social housing. So that's how we allocate our homes, the council housing and other social housing owned by registered housing providers. So that process is underway, and it will be a two-stage process, and we will be working with Housing Policy Committee to take that through. I think the timetable for approval for that is spring next year, so that work has started to ensure that we are prioritising those most in need going forward.
Yeah, just add to that as well, as part of the new allocations policy, we are looking at making sure that those properties that have already been adapted, improving the allocation process for those to make sure that they generally do go to people who have those needs as well. So that's something that's in the new allocations policy.
I think all the political groups have been briefed on that, and I think it's out for consultation at the moment, or just finished, or just about to finish the consultation. Thank you. So there are two recommendations for that, and they are on page, 55. So the first recommendation is to note the Housing Policy Committee that the Housing Policy Committee on 19th of June 2025 gave approval for the new 5-year Older People's Housing Strategy 2025-2030, consider and endorse the decision taken by the Housing Policy Committee and endorse the adoption of the new 5-year Older People's Housing Strategy as set out in Appendix 1. Are members happy to agree to those two recommendations? Great, that's unanimous. Thank you so much for coming to present and for all your work leading up to it. And we now have item 11, which is the joint equipment contract update, and I believe Martin is coming to present for us.
Afternoon, everyone. My name's Martin Smith. I'm Assistant Director of Transformation and Delivery in a joint role between the Council and the ICB in Sheffield. And one of the joint areas I look after is the procurement of the equipment service. So everybody's seen the paper, so I'll just do a summary of the key points, and I'm happy to take any questions. So the report seeks the approval from the committee to initiate a joint procurement process for the Integrated Community Equipment Service in collaboration with Rotherham Council, and it outlines the reasons why and the timeline for doing so. So the contract currently finishes in April 2027, but procurement advice from both the council and the ICB side, as it's a joint service, is that it will take 12 to 18 months to do it properly, for the consultation, to add in all the elements. So this is why we're coming early to ask for this. It does support the statutory duties under the Care Act to have an equipment service, and with this re-procurement we're intending to align some of the areas we've been talking about today, which is around the tech strategy, around optimised care, around the hospital discharge work, and feeding in anything we've currently got to make sure that the service is as up to date and as aligned as possible. Just a summary of the current provision, it's a £5.7 million contract that supports adults and children. It supplies and maintains and drops off equipment to support people, you know, in the community, so the early prevention support, and it supports discharge. We've got a credit model, which means the more we recycle and bring back, the more credit we get in for the current service. So supporting people and communicating out with communities around recycling is really important for this, and supports the reduction in waste. And the current contract provider is Mediquip, and the base is in Rotherham. That's partly why when we said the contract was coming out, we had a conversation with Rotherham, Doncaster, Barnsley, all the ICB sort of partners, and saying this is when our contract timelines, we've got an opportunity to jointly commission on a wider scale. Part of that supports what's happened in Doncaster recently with NRS, which is another big equipment service provider, who has declared that they're not financially viable. So there's a few providers around the country now that are really challenged around that. So a bigger contract with more requirements provides scale for the market, and we think provides sustainability. So we've got this opportunity now with Rotherham, who are interested. They haven't formally taken it to their committee yet, but we've been told informally, yes, they're very interested in a joint contract with us. There is that alignment. We share resources now. We share the same base. We share our special equipment, our special ordering that's not on our catalogue. We've got a lot of process alignment with our catalogues, and we've got a good relationship. So we think that it's the right time to look at a joint contract across both. The large-scale contract, we think, gives sustainability, resilience, equity in terms of Sheffield and Rotherham. Currently, some people in Rotherham can access things that Sheffield can't, so we think that it provides equity across the board. We can bring in the new technologies, and we can support some of the efficiency asks, we believe, with economies of scale of buying equipment at a larger scale. There's evidence of a more councils coming together in a larger scale in East Riding. There's also in Bedford and Luton. We looked at where this is working currently. They haven't given us financial saving figures, but they've said it's improved processes, it's improved relationships, and they believe it's improved the finances. So that's something we'd like to build into a report going forward around why we think it's the right thing to do for quality and for financial ability. There are some risks. So the risks are, with a bigger, more complex contract, we might shrink the market down as to who can actually provide a contract of this size. There's a lot of complexities working with a different council, although in the paper it sets out the governance around a joint leadership group around this, supported by the strategic executive group, around a finance and operational group to align the processes and how we would work together. The finance group working specifically on the model, so we would like to keep the credit model, and if there's overspends or underspends in each area, it needs to be really clear about how that's sorted, because we've both got our own financial budgets to manage. But we think that we can still manage that. In the paper, it puts out, this is the governance we've set up, and we've already got that in shadow form now, ready to step up. We've got the timeline in there, so effectively we're currently speaking to stakeholders about what a new service would look like. So for prescribers, how's it working now? What do you want to change? And we'll be speaking to all the different groups, and we've done the full EIA in terms of understanding who and what groups we need to communicate with across this, because it goes across the spectrum and adults and children. What our advice is to have a new service up and running by this time next year. So we've got that process in here about market engagement, tendering, getting the information in. So today we're asking to go forward with the joint procurement, although everything we're doing sets us up for an individual procurement if the risk becomes too great, so we can separate if it becomes unviable or there is opposition to a joint contract. Thank you.
Thank you. Before I bring Councillor Sapwell in, I just wanted to say thank you for the work and answering lots of questions when we've had the briefing. You know, from my point of view, you know, the kind of argument that you make about the bigger footprint makes sense also because of the way the ICB is going. It makes sense. It's a shame that it can be done across the region, but obviously you also highlight the risks because the systems are slightly different. So is, you know, I am supportive of it, provided that we have really close risk management in terms of the operational things that always go wrong when we merge or separate. There's always like, you know, things to do with data and, you know, how we use systems and all of that. And so provided that we have really solid oversight of those kind of risks and how we mitigate if things go wrong. It sounds like, from my point of view, it sounds like a good idea. Also, the timeline says that the contract starts on 1st of April 2027, whilst you said this time next year. Could you clarify that?
Sorry, Emma. We'll have a mobilisation period. So from September to that period, mobilising the contract, getting it ready, making sure we've got all those things sorted in terms of the operationalisation of that procurement period.
Councillor Sapwell.
Hi there, thank you very much for this. This all sounds outrageously sensible, so good. My question, just in the light of our budget predicaments and the fact that some savings that were promised to us in the past weren't realised, you were mentioning recycling, and sorry to bring the tone of the conversation down, but a lot of equipment required for discharge regards toileting. How much is realistically going to be able to be recycled? How many of the savings, you know, projected are baked into the kind of the funding proposal, and is there a risk that we might fall short with things not being recycled and therefore not making the savings we were anticipating?
Thank you, Councillor. It's a very, very good question, and I would say that there is a reality. The original contract that was let in 2020 had an assumption of an 80% recycling rate. Now, we've been working hard to get that to more like 55 in reality. So we have got an outturn. So we know over the last 5 years what the average has been. And also we've been working with the provider to say who's best in the country. So what's the best rate in the country? So our aspiration is to get from where we are currently to somewhere near the best in the country, with that reality check that, you know, there's no point in setting up a contract that is destined to fail in the beginning by having something that's wildly optimistic. But we do know, you know, some of the best are getting 70. So what do we need to do to drive it up to those levels, 70-75% recycling? And some of that is communications with communities, with people about where they can drop stuff off, how can they recycle, and some of it is working with the provider around more regular collections and making sure that we are getting stuff back, cleaning it and putting it back out again. So yeah, we've got a reality on the recycling.
Councillor Gilligan.
Thank you. Yeah, I agree with Will. It sounds a very sensible policy and I support it. And I hate to bring a bad note into it, but mine's also about finance, and it's about the bigger picture, because we're having a finance update after this. We know that councils across the country are struggling, and sometimes they are taken under control, which stops them spending. Are we going to make sure we've got clauses in there supposing Rotherham could no longer support this project? Are we going to have safeguards in there to make sure that we can carry on, I guess?
Yes, yeah, that finance subgroup, that's the detail we're asking them for the assurances on things exactly like that. And if there's overspending on Rotherham residents, that it doesn't, it means that the budgets are separate in terms of, but the contract is joint or aligned. So yeah. Yeah, there's clauses. Yeah, there's clauses.
Great, thank you. So I will move on to the recommendations that are on page 226. There are three. First one is agree to jointly commission an integrated community equipment service in collaboration with Rotherham Council from April 2027. Number 2, adopt a model of joint governance and a dedicated CES team and agree to pooled funding via Section 75 arrangements. Are people happy to support those recommendations? Thank you very much. Thanks, Martin. And we move on to item 12, which is the 2025-26 quarter 1 budget monitoring report, and Jane is going to present.
Thank you, Chair. My name is Jane Wilby. I'm Assistant Director of Finance and Accounting for the Council, and I'm here to present the 25-26 quarter 1 financial position. The report that you have is a copy of the paper that was first presented to the Finance and Performance Committee on the 18th of August and is being shared with each policy committee this month to ensure transparency, strengthen governance and enable accountable decision making across all service areas. The format of the report has changed slightly with a more visual approach to the appendix, where you can find further information on the committee-specific budget areas. At quarter 1, the Council is forecasting a year-end overspend of £28.2 million, driven primarily by persistent demand pressures in adults and children's social care, SEND transport and homelessness, alongside pressures in the dedicated schools grant and in the housing revenue account. To partially offset the position, £22.8 million of corporate mitigations have been released into the outturn position, which include £7.9 million housing benefits subsidy loss provision, £5.1 million for high cost placement growth, and £9.8 million from our 24-25 collection fund surplus. The report covers some of the targeted recovery actions that are in place. The Council has launched a series of service level programmes and corporate financial measures to reduce the overspend. These include in children's services, we're continuing to review care placements, investing in in-house provisions and improving the home to school transport provision. In housing, we're continuing to reduce contemporary accommodation costs by minimising bed and breakfast placements and accelerating permanent housing transitions. The Adult Social Care Committee, the forecast overspend stands at £31.3 million as of month 3, which did improve by £3.4 million since the month 2 forecast due to new savings coming forward. The main pressures are rising demand, complexity of need and increased staffing costs, and delays in securing anticipated income from the ICB, which has been temporarily removed from the forecast pending further negotiations. The overspend specifically relates to £11.7 million of roll forward pressure from 24-25, £9.7 million shortfall in our BIP savings delivery for this year, and over £10 million in additional growth we experienced a spike in demand for services in autumn 24, which fell outside of the planning cycle and resulted in baseline costs outstripping the budgeted growth in the service. Of the £24.6 million budget implementation plans, or BIPs, £5 million are deferred until next year due to tech-enabled care and service modernisation initiatives, and 4.7 are forecast to be undeliverable due to NHS constraints and limited income generation opportunities. Now, teams are actively working through the budget implementation plans and expect improvements as we unpick these, but we are taking a very cautious approach to the forecasting at this stage. In response, a number of actions are being implemented to stabilise the position. An Adults Improvement Board, which is chaired by the Chief Executive, is playing a central role in driving accountability and progress, ensuring that improvement plans are monitored and that corrective actions are taken swiftly to mitigate the risks and improve service delivery. The board is providing strengthened financial oversight and accountability for the recovery plan and budget delivery. It's driving targeted reviews of high-cost placements and standardisation of short breaks, and is strengthening the decision-making and authorisation processes at all levels. There are some new activities and lines of inquiry that are being scoped, which include the procurement of new AI tools. We're reviewing discretionary top-ups. There's peer challenging authorisation and decision-making at all levels, a review of top-ups in home care, direct payments, residential and out-of-area packages, and reinstating provider flex-up and reduction levels, and a review of internal day services and operational efficiencies such as pool car usage. In response to the overall financial position, the Council has introduced organisation-wide spend controls too, which include a 6-month recruitment restriction which is expected to save £6 million, with a further £3 million from vacancy factor budgeting. We've also introduced discretionary spend restrictions with centralised monitoring processes, but for both of these areas, there is clear exemption criteria. We anticipate that targeted and corporate measures in place, we can drive that overspend down to a position of under 20 million by the end of the year, and finance teams are actively monitoring and driving down these targets with services. The measures coordinated across governance forums, including Future Sheffield Board, Performance and Delivery Board and the Budget Improvement Group, are ensuring that strategic alignment and accountability. As we face these challenges, the Future Sheffield Transformation Programme has become even more vital in reshaping council services to a more sustainable and efficient operating model and financially sustainable position. It is important to recognise these pressures are not unique to Sheffield. We're actively engaging with national government on consultations on funding reform and welcome the government's commitment to a 3-year local government finance settlement from 26-27. The longer-term funding horizon will enable us to plan our budget strategy with greater confidence, particularly in contrast to the current approach, where annual funding allocations are only confirmed in December, just before the financial year begins. We expect to receive further detail from government in November 25, which will be critical in shaping our forward planning. So while the position is extremely challenging, the Council is responding with urgency and focus, and sharing this financial update with each policy committee is ensuring transparency, strengthens governance and enables accountable decision making across all service areas. So the next quarter's update will be presented first to the Finance and Performance Committee in November and then to all policy committees in December. I'm happy to take any questions, and of course Matt as well would support that.
Questions? Councillor.
Thank you. I'm slightly wary of asking about it because I suspect that there aren't kind of currently any concrete answers, but the slippage of efficiencies from income from continuing health care, this was something that a number of us flagged during the budget process last year and earlier this year. I think there was a general nervousness, Chair, wasn't there, that this was not deliverable, and it was probably kind of the least secure saving that we agreed to put through. So it's not surprising to see it in that position, but what factors are currently in play around that and potentially influenceable, and is everything possible being done to influence? Obviously it's a bit of a tightrope relationship between the council and the NHS in terms of who exactly pays for what, and it's not in any patient's interests to have that scrap over money going on when all they need is the care. So that, you know, the ultimate is that people need care when they're coming out of hospital or whatever, and they don't care who's paying for it, they don't care how quickly the assessment can be done, they just need the care there. So, you know, it's all for us to deal with behind the scenes, but you know, what kind of position are we actually in here given the situation with the ICB budget? Are there still tensions there? Does things still need resolving, or are there constructive conversations happening? I understand it's a difficult conversation for both bodies to have.
So you're absolutely right, it is a really, really difficult position, and the commissioning arrangements are extremely complex, and I think that's part of the difficulty, is unpicking some of those arrangements. So we have taken quite a cautious approach to what we've fed into the outturn position. So with a fair wind and actually some further work and negotiations with the ICB, we might hope that might improve in later quarters. There has been some significant discussions with the ICB, so I don't know, Matt, would you like to come in and comment on some of the discussions that you've had with health colleagues?
Yeah, thank you. I think your analysis is right, Councillor Milsom. This is an inherently risky area, and we need to be cognizant of the fact that we didn't know at the point that the savings were set that the ICBs would be reduced by up to 51%. We acknowledge that the entirety of the ICB across South Yorkshire, not just Sheffield, is in a challenged position financially as well. which makes resolution of the process even more complicated than it was at the start of the financial year. In terms of where we are right now, this has been formally escalated up to Gavin Boyle's level. We've now submitted quite extensive data for some cases that go back as far as 3 years, with supporting data on a case-by-case basis. The ICB are due to come back to us on a position with each one of those cases by the end of this week. And I've had assurance from Ian Atkinson today that that is going to happen as per schedule. What will then happen is that we will need to go through and resolve those cases on a line-by-line basis. Now, the complicating factor here is that there is quite a significant level of discretionary funding held between both organisations. The ICB's indicated that where cases are identified as being fully CHC funded, there may be a corresponding risk to the council in terms of some of those discretionary funding elements. So ultimately where we need to get to is a bottom line position that makes inroads on that overall overspending position. We're hoping by the end of October to have got through that list, get to a clear and definitive position. And I think it's fair to say neither I nor my colleagues in the ICB want to be wasting our time over a tug of war that proves to be futile for both organisations. But in terms of the scale of the challenge, the scale of the overspend, the scale of risk to both parties, we need to reach a definitive position that's going to be best fit rather than the ideal outcome for either of us. So that's where things have got to at the moment.
Just to comment, thanks both. Just to comment about that, I mean, I have asked questions about whether the cut to the ICB budget this year has any impact on the, I think they're called nurse assessors, who are employed by the ICB to assess people for CHC. And I've been told categorically, no, there's no impact on the employment, the staffing of that. So that's, as far as I understand it, not where any risk lies. So is the risk in staffing the resolution of cases? Is that what you're saying?
Again, a very perceptive and relevant question. So part of the detail in terms of the negotiation, we've modelled the likely timescales to work through those cases and the capacity needed both from a social work and a nurse practitioner perspective. When we do reach a final settlement, part and parcel of that will be then factoring that timescale into getting to the end of those assessments and agreeing what the consequences are if either party is unable to achieve what we've set out to do in terms of pace. So I think the outcome will have to be king here. If we don't have the capacity, there can't be a default assumption that the status quo is maintained given the extent of the overspend.
Thank you. Councillor Crosthorne. Thank you. When looking at a budget variance of this scale, I think my first instinct was to refer this to audit and standards, but we've received advice from legal that that's not something that's within the scope of the policy committee. At policy committee in March, we received a report saying that the 29.4 million of budget implementation plans we'd agreed as a committee and voted on, that they were deliverable in year, there was no slippage, and then we had an overspend of 9 million with undeliverable savings of 0.5 million pounds. Again, at Finance and Performance Committee in June, they had received a report which said broadly similar, 29.4 million savings deliverable in year, no slippage, overspend of then 11.9 million, and undeliverable savings of 0.5 million. At the recent Strategy and Resources Committee, however, officers had highlighted that there was awareness of this variance problem from the start of the financial year, but at no point did either of those reports really at Finance or Adult Health and Social Care, or even in briefings until very recently, that we had a budget variance of this scale. And I do have a big concern with that, because we are talking about a variance of tens of millions of pounds of public money here, and that's quite damaging to public confidence. And I do think we do need to get to the bottom of the how and why that's happened, so we can apply that learning across the council. Conversely, the way forward is really positive and really promising, and I do wholeheartedly thank officers for their work on this going forward. There is a question remaining, though, of how on earth did we get here? So
as we can't refer it to audit and standards, can I propose that we add something to our work programme? So can we add a report on how we've got to the financial position of a 31.3 million in-year budget variance? Something that includes an examination of the governance, budget mitigation and planning, and whether those appropriate reporting and policies have been followed, and a copy and review of the external auditor's value for money assessment, risk assessment report, which is, I believe, being considered at Audit and Standards Committee tomorrow. I don't know, Chair, whether you want to pause so that groups can discuss that.
I am happy to just bring Sherry in that can advise on whether that is possible. Councillor McClean, do you have any problems with us adding to our work programme?
Just hear from Okay, just hear from Sherry.
Okay. Well, obviously, as I've been advising separately, Sophie, regarding this, that obviously you have within your own remit and your own powers that you can obviously look at and scrutinise your own policies and your own report schedules. So that's why it sits within the work programme. I have no view. I have no what the wording that's been proposed has obviously been sent to me as well, and I'm happy that that can be added to your work programme. So I think, I mean, what I can see is being proposed, obviously, by Councillor Crosthorne, is that just want to have a look at what's already going anyway to audits and standards, which is your value for money, which obviously this is all in there, where that report will go to them. So I suppose it's just a matter of that coming in a little bit more detail, or giving you members together in your work programme space just an opportunity to just to have a look at it and review it a little bit in more detail. So that's what's being proposed.
I have Councillor Sapwell first, and then I'll take
Yeah, just to completely back up Councillor Crosthorne, as a doctor, if I receive a gift of more than £10, I kind of encourage, one, not to accept it, and two, to register it. For the council to have lost essentially £20 million, you know, the fact that this also pertains to healthcare, like Sheffield's public will want to know exactly what's happened, and I really exactly how this needs to happen. But I don't know the legalities, but this needs to be looked into. We need to find exactly how this happened and to prevent it from happening again. And so to that extent, I mean, I'm interested in this report to see that it said that there was a high complexity of need and a spike in demand in 2024 in September. Like, oh, there's not just winter pressures. Like, what happened? Why did we not spot, you know, that spike in demand? What happened for our demand forecasting to go so horribly wrong for this to happen? Why is it so different to previous years? Was the CQC inspection part of why, you know, the numbers didn't add up that year? And what's being done to make sure that our forecasting improves in future?
Sorry, can I just come in there? I think Jane has presented how it's happened and what the reasons are that we know. That's all that is being made available to any of us, including the leaders. So all three groups have been briefed on this. CQC has got nothing to do with the financial situation, because we've been waiting for CQC for the last 2 years. We were notified in April. We were waiting for it for basically 18 months for the call. The financial situation has no bearing on CQC. Obviously, they want to see how resilient we are. I also want to point out that the financial situation of the council in social care doesn't have a direct impact on the services. People, you know, we deliver really good services to the people in Sheffield, and our safeguarding measures are good or better, I would say. So from the point of view of the services, they are not in any danger. So giving that impression in a public meeting, I think it's irresponsible. I really, really like you want to understand, you know, why it's so different. And I have been asking questions at all levels since this has come to light, as have, you know, across Sophie and Laura. We've had many meetings with the DAS. And you know, I appreciate the fact that, yes, it's good to have something on the work programme. I think there is nothing that, you know, as long as the information that is put in the public domain is accurate and is safe to be put out there. But I really don't want to kind of put the burden of this on, you know, we have, as a committee, we have acted on the information that we've been given, and we've scrutinised the reports that we've been given, and we've asked lots of questions, as Councillor Milsom said. So I don't know if Matt wants to add anything to that. Or
I think it's just to really clarify to everybody that, as I say, there is a report that's going on the 18th, which is obviously going to look at this in great detail. So from my assumption of what we're being asked is that you just want that to come back to Works Committee for you just to discuss that. So it's not that people aren't looking at this and looking at what that area is. You know, we've got external auditors that do that job very well.
Councillor Rooney wanted to come in, unless Matt wants to.
Councillor Sapwell, can I just tell you that we cannot turn someone down who qualifies for our services because we don't have the money. If they need and are qualified for a service, they get it. That's why we have an overspend, because fundamentally the budget isn't big enough. It's very simple. I'm trying to work out what the underlying tone of this request to go to audit is for. Are you implying something untoward's gone off here? Because the officer has given, as they do generally monthly, an oversight of what they believe the causes of the overspend are. So if you think it's something else, please say so. And my suggestion would be, if you want to really scrutinise it, send it to the scrutiny board, not to audit, the scrutiny board.
Thanks, Councillor Rooney. We cannot send something to audit anyway. It's not in the Constitution. As a committee, we're not allowed to refer, so it's irrelevant. I'm going to bring Councillor Milsom and then Councillor McClean.
Thank you, Chair. I do think I want to underline what you've said about the irresponsibility of using certain language in this committee. We have officers who are doing their job. We have councillors who are not financial experts who do their best to scrutinise, but we only act on the information we're given. I don't know who you're blaming, but I think to start your statement with suggesting that somehow £20 million has slipped down the back of a sofa and no one's looked for it, I think is highly irresponsible. And we know that members of the press, we know that members of the local press...
Councillor Rooney,
if I can finish. We know that members of the local press observe these meetings and often quote what is said in the meetings, and I think you should make it very clear, Councillor Sapwell, that you do not mean that money has slipped down the back of a sofa and no one's looked at it, and make it sound quite so flippantly irresponsible on the part of, I don't know who you're accusing, officers, I presume. But I really think that's a very serious thing to say, and it will be a headline because it sounds sensational, and we know that the press pick those things up. It's happened countless times, and there'll be lack of context around that in the press, and that's a very dangerous thing to say.
I don't think Councillor Sapwell quite said that, Councillor Milsom. Councillor Sapwell... okay, can I just draw that to conclusion with Councillor McClean?
Thank you, Chair. I think my suggestion would be that, as Sherry has advised, the scrutiny of the finances within our committee's remit, we receive the monitoring reports, quarterly monitoring reports from finance, and I feel that it is quite a comprehensive report. We also have our briefings in between these committees meetings where we have access to information, access to the Director of Adult Social Care, and we've had detailed briefings on the financial situation, and I feel I have a good understanding of where we're at and the reasons why the current in-year budget savings are or are not progressing. And in light of that, and also our work, we've done quite a lot of work as a committee in the last 6 months on our work programme as a whole, and making sure that we don't add things onto it unnecessarily and that everything is sort of seen and heard in the right place. I would be wary of sort of making this decision about the audit and standards report to bring that to us into our work programme, because they haven't heard that report yet and they haven't had a chance to make their decisions on that tomorrow, and that's something that's very much with them and they've not done their work on yet. So I personally feel as a committee we should hold back from that. I share everyone's concern about the financial position. You know, we all have come from different parties, but we all have the same aim, I hope, which is that we want the best for our city, and on this committee we want to ensure that people in our city can live the lives that they want to live. And like I say, I feel as we have spoken about the budget and we will continue to do that, and I just wonder whether maybe we could have a whole committee briefing on this, and we could look at the report from Audit and Standards. We could have another chance to ask questions of officers and then decide whether this is something that we feel needs to be on our work programme for this year. That would be my way forward. Thank you. And I also just refer to sort of conversations we've had also recently in committee about how that we try and work together cross-party to make sure that the business of this committee is efficient and that there are no surprises. And yet again, today we're in a position where we're in a surprise. Officers who work diligently on the work programme and the work of this committee are caught last minute trying to grapple with things. I just think we really need to focus on the business at hand, which is doing the right thing for the people of Sheffield and being mindful of the officers who work hard to support that. Thank you.
Thank you. Councillor Crosthorne.
Thank you, Chair. Just to address the point in the room about the tone of this, obviously we have in front of us that there is a 31.4 in-year budget variance on adult health and social care. People are going to want to know how and why on earth we got there. I think that's a perfectly fair and valid question to be asking, and something that that's come up a bit in the debate that we've been having is about having the access to the information that's in front of us and us scrutinising the information that's in front of us. But it's obvious that from the report there are budget mitigations that we have voted on that haven't necessarily been robust, and how that was allowed to happen and how we can go forward from that and learn from that for the future I think is really important. The fact that our demand forecasting, clearly there's some issues there, I think that needs to be looked at, and I think that is something that we can bring to an examination of this budget mitigation planning so that we don't have this problem again. As I've said before, I do have confidence in the way that this is being handled. I'm incredibly grateful to the officers that are working really hard to bring this in-year budget variance down. However, how we got here in the first place is a really important question to unpick, and I think that needs to be added to our work programme as appropriate.
May I suggest that rather than, it looks like we're not going to have agreement on adding today as to the work programme, but can we have another conversation maybe in a briefing, because we talk about work programme all the time, maybe add something to the next DAS report, but have a whole committee briefing on the finance for everybody to attend. Then we can decide how we want to move forward in terms of how we got there, because it might not be appropriate to have it on the work programme. It might be, but I want to just double check if that is the right way forward. I'm happy to have the whatever goes to audit and the minutes from audits and how they look at the best value for money to come back to us next month, because that will already have been discussed tomorrow, and we can just look at their report and what they've looked at, because I haven't had a chance to have a look at that, and see how the conversation goes for them. But can I suggest that we have a conversation in a briefing about how we move it forward in a way that is also workable, because it might be that it's not workable having it every committee, because maybe we don't have all the information all the time. Councillor Course.
Thank you, Chair. I appreciate that. I just want to make sure that that we do deal with this in a public and open setting, and it isn't going to come across like we're just going to take this to a private briefing away from away from public scrutiny as well. As I've tabled an amendment, do we need to vote on it?
First.
Can we read, sorry.
They've asked for an amendment.
Yeah,
So
but
you want to get that
I haven't got it in front of, me. Thank you. So, Councillor Crosthorne, you are presenting an amendment. Do I have a seconder? It has been accepted by legal. Yeah. At the moment, sorry. So the amendment reads as possible. So as follow. So I have Councillor Crosthorne presenting it and Councillor Airy seconding it, and it says, to add to the work programme, a report on how we have got to the financial position with a 31.3 million in-year budget variance, including an examination of the governance, budget mitigation planning, and whether the appropriate reporting and policies have been followed, and a copy and review of the external auditor's value for money risk assessment report, which is being considered at audit and standards on the 18th of the 9th. So I'll put that, Councillor Rooney.
I don't accept the fact that that amendment is admissible, because I don't think it is. Because I think we've had other legal advice that says it isn't.
Right, so...
I'm sorry.
I just wonder...
Sorry, Sherry.
No.
Councillor Rooney.
I want to speak. I'm going to speak. You might not like it, but I'm going to speak. I want to know what the Assistant Director of Finance has just spent about 20 minutes explaining to us, Councillor Crosthorne. What has she just done? Sat and lied?
I don't, Councillor Rooney, I don't think it's relevant, and it's not helpful actually. So the amendment, this is a different amendment to what was presented before the meeting that has gone through legal. This equally has gone through legal. Legal have come back to us and have said, that it is admissible. I take the expertise of the people that know the law, the constitution and the finance above your opinion. So I have to accept that amendment, and we're going to put it to a vote. Okay?
Could I briefly have just 2 minutes to chat to my group? Is that okay?
It was important that people could confer with their group. I think as much as we can, we try to have these kind of issues ironed out in pre-meeting or in a pre-agenda meeting, and it would be helpful if that could happen, because it just means that officers don't have to do things last minute, and also doesn't put groups in a position where they have to get out of the room to have a conversation with their colleagues. So we are going to vote on whether to accept the amendment. So can all those in favour of the amendment proposed by Councillor Crosthorne and seconded by Councillor Ayres, all those in favour, please put your hand up. All those against?
Those against?
Abstentions? Okay, what happens?
Right, so we have to make another movement.
Okay, so there are...
We haven't got... Sorry? Sorry? Sorry. Oh, sorry. So we
have 2 people who are not voted, namely...
We've got 2 people who haven't voted. Oh, you did vote.
But are you abstaining against or for? Yeah, and you didn't put your hand up when you abstained. Could I have all abstentions, please?
Right. So we haven't got a decision at the moment, so we need to make a decision, don't we?
So can I cast my vote then?
You can.
So I will be for.
So you're for it as well. So that's 1, 2, 3, 4, 5. So that's been passed.
Councillor, I think Councillor Gilligan abstained as well.
Did you abstain?
Yeah.
So that's 5-4 then, isn't it? So that's been lost. Oh no, they haven't. They've abstained, haven't
Yeah.
they? Yeah.
So it's not been lost.
So we haven't got a decision at the moment. So you're going to have to. We're going to have to. We're going to have to.
There is a decision because I have the casting vote. Yeah.
Can you just take the votes for me?
Yeah.
Because I've not.
Yeah, so we've got 2, 4, 5, 8, 9. Yeah, so we've got 5 abstain and 4.
Yeah. So we have. Yeah. Yeah. Sorry, that's been passed.
Yeah.
Sorry.
Yeah.
Sorry.
Okay. Great. So can we go to recommendations now that are on page 2 of the extra paper? So the committee is recommended 2. So I'll go through the first 2 recommendations and then I'll have to have that one in front of me again. So note the updated information on the 2025-26 revenue budget outturn as described in this report, including the detailed committee budget monitoring information and management action provided. Note the targeted action and work underway to bring the in-year forecast overspend down. And in addition, recommendation number 3, to add to our work programme, a report on how we have got to the financial position with 31.3 million in-year budget variance, including an examination of the governance budget and mitigation planning and whether the appropriate reporting and policies have been followed, and a copy of the review of the external auditor's value for money risk assessment report, which is being considered at audit and standards on the 18th of the 9th. Are people okay to vote for those recommendations? All those in favour, please could you raise your hand? All those against? All those that abstain. These are all of the recommendations.
Oh no, sorry, you've already done that.
Yeah. Yeah. No, you can say you want to vote in part. Are we allowed to vote in part? Yeah. So. Okay. So shall I do it again? Sorry, I thought it was obvious. So all those in favour of the recommendation, all 3 of them with the added one? Do you want to vote in parts?
So the 4 Labour colleagues will be voting for the original recommendation that came with the papers ahead of the meeting, but abstaining on the recommendation that's just been added by the amendment. Thank you. And can I just add, in terms of abstaining, I know I spoke earlier when we were discussing, but our reason for abstaining is that the monitoring is ongoing. We're getting our quarter 2 report, which will be coming to committee. We have our ongoing briefings. And just to reiterate that reasoning, thank you.
Thanks, Councillor McClean. Yeah, we've got that now. So Laura, do you mind turning off your microphone? Sorry. I believe that all 3 recommendations, including the added one, have passed. That concludes the business of the meeting of today. Our next committee meeting is on the sometime in, is it the 22nd of October? I think it's in the morning.
Yes.
Yes, it's at 10 a.m. Wednesday, the 22nd of October. Thank you very much for everybody, and thank you very much to the officers for all their hard work.